The Human Sciences Research Council will present and host a symposium at the 8th South African TB Conference. The conference is taking place from the 4th to the 7th of June at the Durban International Convention Centre. The symposium, titled Understanding TB in South Africa, Knowledge, Prevention, Screening and Therapeutic Thresholds, took place today. Experts converged to discuss various aspects of TB in South Africa, including knowledge and awareness, prevention, screening and treatment. Delegates will share findings and insight from recent studies and projects, highlighting the need for more efforts to address gaps in the TB response to end it in South Africa. The session also provides a platform for discussion and collaboration among stakeholders, researchers, as well as policy makers. Professor Sizulu Moyo, Research Director in the Public Health Societies and Belonging Research Division of the Human Sciences Research Council, joins us for a discussion. Professor, very good evening to you. Thank you so much for your time. As you gather to come up with some solutions and also take stock of the current impact of tuberculosis in South Africa, what are some of your findings as you try and gather the research to assist in the curbing of tuberculosis?
Good evening, Paul, and good evening also to the viewers at home. Thank you very much for the opportunity to speak to you. I am coming to you from Durban in my hotel room, so the lighting may not be perfect. The 8th South African TB conference started yesterday. It's running this week and is taking place under the theme Accelerating Progress to End TB. There are various sessions and various symposium and satellite sessions that are taking place during the conference. The pictures that you're showing are actually part of a roundtable discussion that was held this morning that looked at TB prevention, various aspects of TB prevention, the roles of various modalities such as TB preventive therapy, nutrition. We know that when people are undernourished or when they are not well nourished, their risk for TB and also how they do on treatment is suboptimal. We also spoke about vaccines and we also spoke about the impact of addressing HIV, because we know that in South Africa, most of our TB is driven by HIV. Now, coming to the symposium that was held by the Human Sciences Research Council within this conference, we put together a number of topics around TB, looking from some of the work that has been done specifically by the HSRC. You mentioned the topic around knowledge. One of the things that is becoming clear as we progress in this conference is that tuberculosis is a biosocial disease. We need a comprehensive approach to address it. And part of that comprehensive approach includes things like what people know and what people understand about TB. What do we as communities know and understand about TB? For example, how do we then seek care? If we know about the symptoms of TB, normally we talk about the 4 common symptoms of TB: prolonged cough, sweating a lot at night, loss of weight, which you cannot explain by any other reason, and also loss of appetite. Sometimes there is coughing out of blood. There may be other symptoms, but these are the common ones. So when people know that these things could be TB, then we can take the appropriate action to go and seek care. Secondly, when we understand that TB can be treated and it can be cured. However, if we don't take our medication as required for the required amount of time, people can actually die from TB. Yeah. The data from the WHO indicates that in 2022, an estimated 54,000 people in South Africa lost their lives to tuberculosis.
Professor
so there
Moyo,
is the
if you'd
spectrum.
allow me, just looking at some of the gaps that need to be filled, what efforts are needed to address the gaps in the TB response, and of course looking to end TB in South Africa, more so as we consider the impact of COVID-19, the pandemic, and how the focus shifted to the COVID-19 as opposed to garnering and progressing the research around tuberculosis and seeing more and more people getting infected, some not even taking their medication at that time. How far behind is South Africa insofar as catching up from COVID-19?
Thank you for that question. So just to go back to what I was saying around knowledge, we know that in the COVID response, for example, knowledge was very important. So this is one of the gaps that we have to address in South Africa in terms of trying to deal with TB. Now, coming to where we are as far as COVID is concerned, the National Department of Health was actually very proactive in the sense that there was a TB recovery plan that was implemented during the time of COVID-19. When we saw that testing had gone down in 2020 during the peak period of COVID, and also because there were travel restrictions, there was a comprehensive plan that was put together to help South Africa maintain that momentum in terms of making sure that the services for TB are maintained. And this has actually augured very well for South Africa. Well, there are gaps, obviously, but we have made progress in terms of trying to regain that momentum. So there is a lot of work that is going on around the gap of finding the missing people in communities who do not have TB. Once they are found, South Africa is one of those that has implemented molecular testing that is rapid and works very well to detect TB. So that is a gap that is already being filled. A key issue is around us making sure that those who are detected to have TB are immediately put on treatment and they stay on treatment, because TB treatment is not a week, it's not 2 weeks, it's longer than that. So that is one gap that is being addressed. How do we support ourselves when we have TB to remain on treatment? So while there are gaps, I think that there's also a reason to say there are things that are working well. How then do we strengthen those things that are working well? A final gap that I just want to speak about is around support, around the nutritional support, for example. We know that there's evidence around that people need to have good nutrition to remain on treatment and also to have better treatment outcomes. So this is one gap that has already been discussed at the conference with regards to how do we strengthen this aspect, even in the context where we know that Department of Social Development does provide support for people who need social services, but how can we strengthen that in the face of TB?
Yeah. And what are some of the opportunities for collaboration amongst the stakeholders that are there, more so as you continue to monitor some of the trends around TB?
Thank you very much. So key collaborators is civil society. And if you look at the program that we have, civil society plays a significant role in supporting the National Department of Health, in supporting implementing partners, and even supporting researchers who then come up with these innovations. So those are the some of the opportunities for collaboration. Also, we've got different implementing partners and also different research groups. So in this type of conference, there is that exchange of ideas, finding common ground for us to be more effective in our response.